Hi, what brings you in today?
Well, I feel healthy, but since I turned 45 and I got this letter about breast cancer screening, I've been talking to my friends about it.
That's great to hear that you and your friends are talking about this. We recommend that women between the ages of 45 and 74 who don't have any other risk factors get screened for breast cancer by getting a mammogram every 2 years.
So, what are risk factors? Is that like family history?
Yep, that's right. 1 in 7 women will develop breast cancer in their lifetime, and many don't have a family history. By screening regularly, we can detect it at an early age when treatment is likely to work better.
You said something about mammograms earlier. What is a mammogram?
A mammogram is an X-ray of your breasts. It checks to see if there are any changes that are too small to be felt. It only takes about 10 minutes, and it's done in a radiology clinic, a hospital, or a mobile screening clinic.
Okay, so what will happen when I go for a mammogram? What should I expect?
It's actually pretty easy, and the technologist will help you feel comfortable and at ease. Once you're standing in front of the mammography machine, there are 3 steps. First, the technologist will put one of your breasts out on the machine. Then, a plate will press down on your breast for just a few seconds so we can get a clear picture. Then we do this again on the other breast. Once the imaging is complete, you can get dressed. Finally, a doctor who has special training in imaging, called a radiologist, looks at the images to check for any changes.
What about radiation? Is it safe?
That's a great question. Mammograms use very little radiation and are very safe. The benefits of finding and treating breast cancer early far outweigh the risks, and the risks of the small dose of radiation during a mammogram are very low.
Okay, so how long do I have to wait for my results? Waiting for results really make me nervous. I really don't like not knowing things.
Absolutely, I completely understand. You should get your results back within a few weeks of your mammogram, and there are a few different ways you might get your results. It could be a letter in the mail from the clinic or the hospital saying whether your results are normal or not normal, or you'll hear from my office. You can also call me if you have not received your results after a couple weeks.
I don't know, this whole thing feels pretty worrying.
It's perfectly normal to feel anxious or stressed about getting a mammogram and about waiting for the results. As for the mammogram itself, the technologist will work with you to make sure it's not too uncomfortable while making sure that they also get the best image possible. You can tell the technologist any concerns that you have. Each bit of pressure on your breast only lasts for a few seconds, so any discomfort won't last very long. And remember, getting a mammogram does not mean you have cancer. We screen for breast cancer every 2 years to make sure you stay healthy.
Okay, thanks. That is making me feel better. I think I'm ready to book an appointment.
Great, and while you're here, let's talk about screening for colorectal cancer. That also starts at age 45 if you don't have any other risk factors. Also, I'd like to check to see if you're up to date with your cervical cancer screening.
Ooh, that's great. I'm really glad we're having this conversation.
Ask your doctor or regular healthcare provider today about screening for breast cancer. If you're between the ages of 45 and 74, you can book a mammogram without a referral from a doctor. Visit screeningforlife.ca for more information or to find a mammography clinic near you. If you don't have a doctor, visit AlbertaFindADoctor.ca or call HealthLink at 811.